Hello, everyone, and welcome. My name is Dr. Megan LaFollette. I am Executive Director at the 3Rs Collaborative, and today I'm going to be talking to you all about our efforts to advance better science and welfare with a spotlight on our 3Rs certificate course. So, who am I? Like I said, this is a picture of me. I am Executive Director at the 3Rs Collaborative. We're a national US-based nonprofit. My background is that I actually have a PhD in laboratory animal behavior and welfare, where I specialize specifically in human behavior change. So, trying to figure out why people do or do not implement the 3Rs and how we can help them with that. I have a broad background in all 3Rs, and I have a lot of connections across the industry, not only with federal agencies here in the United States like NIH, FDA, accreditation agencies like ALAC, pharma, academia, consultants, biotech, all sorts of stakeholders. I'm going to start this talk with giving you a little bit of information about the 3Rs Collaborative. Our mission is really to advance better science for both people and animals. And we do this through facilitating collaborative 3Rs efforts and really providing this science-based, balanced perspective on all 3Rs. Now, just in case any of you are not aware, I want to go over some modern definitions for the 3Rs of animal research. This is also very important because English definitions and the 3Rs technical definitions are quite different. So first, we have replacement. This is about avoiding the use of animals where they otherwise would have been used. So you might use in vitro, in chemico, in silico, ex vivo, or even training technologies. Maybe that's microphysiological systems, organoids, QSAR, computer modeling, things like that. Reduction is about ensuring that the animal studies that do occur use the techniques to support rigor and reproducibility while minimizing animals necessary to answer the scientific question. So this is things like having fit for purpose experimental designs, statistics, analysis, tissue sharing, improved colony management, and when well justified, animal reuse. The third R is refinement. This is about minimizing pain and distress, providing positive experiences to enhance animal well-being throughout their lifetime. Some examples might be providing enrichments, positive reinforcement training, better housing, handling, pain relief, modifying procedures so they lead to less pain and distress. And it's really important to know that typically reduction and replacement only occur once an animal study has deemed necessary. Now, here at the 3Rs Collaborative, we have over 75 members. Again, lots of diversity here from biotechs, academia, pharma, contract research organizations, and more. Like I said earlier, our efforts are really balanced across all 3Rs. So we truly deal with refinement, reduction, and replacement. We think that this balanced approach really helps support trust across the industry and faster implementation overall. Our efforts really span across critical topics. These are all of our different initiatives that are going on right now. Culture of care actually evolved from compassion, fatigue, resiliency. We have environmental health, of course, our 3-year certificate course, translational digital biomarkers, refinement, NPS, and artificial intelligence. Our strategy has 3 core goals. Promoting the 3Rs broadly as a concept, creating a research environment that's knowledgeable and supportive of the 3Rs, promoting specific 3R strategies by balancing or by advancing implementation of high impact, evidence-based, and practical 3Rs technique. One sec, I'm just going to check this. Okay. Third is actually promoting our organization by building collaborations and awareness of our resources from the 3Rs Collaborative. Now, I was asked to give a talk about our 3-hour certificate course. So now I'm going to take a portion to actually talk just about this specific course, why it was developed, how it was developed, and what it actually provides. So we started working on this course because we really saw that across the scientific field that organizations and individuals are increasingly committed to the 3 Rs. The 3 Rs are being recognized as a really important and impactful strategy to really advance science, to advance the humane treatment of animals, that these are an important concept. They're recognized in varied guidances, so much attention and importance of these. That being said, even though there's a recognition of how important the 3 Rs are and often commitments to implement them, a lot of places and a lot of individuals in the field haven't ever actually gotten specific, standardized, practical, or accessible 3 Rs training. You might have heard the concepts in like one course, maybe you've just read about them a little bit, but there's not really this in-depth training at many different organizations. They're kind of glossed over, and not that much attention is paid. And this can really harm implementation and recognition of 3R's efforts. Because if you just see these as a theoretical concept, but don't actually know how to employ these techniques to actually make a difference, then, kind of what's the point? Is that really that beneficial? Whereas if you give people really practical, actionable information, they can really make a big difference. And so that's what our main goal was. As the 3 Rs Collaborative, we wanted to empower various stakeholders across the scientific landscape to really make a difference in their organization. By implementing all 3 Rs, we really see this as a critical part of culture of care as well, which is about animal welfare, employee wellness, good science, and openness. We think the 3 Rs as a concept can really support all of these things and are just, yeah, they're good for science, good for people, good for animals, yeah, and good for the public. So we launched last January. We've had over 30 different organizations and actually over 50 different individuals sign up for this course. What it provides is this kind of comprehensive, in-depth, actionable 3 Rs training, helps foster integrity and progression and an advancement in the responsible conduct of animal research. It's very accessible, dynamic, and engaging for all different stakeholders. So we tried to really make it relevant, everything from a student to a manager to a researcher to a review body member. We wanted everyone to be able to take something away from this. And then importantly, organizations can track, measure, and benchmark learners' progress. So they can actually buy this for their whole organization, assign people to take it, and know when they do. So, honestly, my dream for this course is that before anyone ever steps into an animal research lab, that they should have to take this course. And honestly, if they're doing anything with human or cell-based work, if they're in this scientific research field that touches animal research at all, I would love them to see this course so they actually know what the 3 Rs are and what they can do with them. So like I said, we really wanted to make this accessible. So it was important for this to be fully virtual, easily accessible online. We wanted it to be self-paced. So, if you're very busy and you only have 30 minutes, an hour each week, that you can complete this on your own pace. You don't have to do it all at once. And then ultimately, we made it about 5 hours. We felt like this was both enough time to go into enough depth to really touch on each R, but not so much depth that then we're going to lose people and they're just going to say, this is not practical for me to do. If you took an hour a week for a month, you would get done in just over a month. If you took 30 minutes a week, you could get it done in 2 months. Or if you have 5 hours, you could just do it in a day. We designed this primarily from a US and Canadian perspective while being globally minded. So, what that means is that when we're actually referencing certain terminology, guidelines, etc., we reference the US and Canada. Including we had input from the CCAC. This was important because this is both where our expertise lies, and then it was also, from where we sit as a US based nonprofit, we really saw a gap in this training in the United States. We felt like there were more courses, more opportunities in Europe. So we wanted to focus at home. But again, like I said, it is very globally minded. Research is a global landscape. Almost everything that we mention is going to apply to other parts of the world. There just might be some things that are a little bit different. We also made it very evidence-based. We developed this with experts who work in a variety of different roles, from veterinarians, technicians, researchers, consultants, higher level review body members, and working at different types of institutions, industry, academia, government, nonprofit, all sorts of things so that we weren't skewing it to have only one perspective. Again, we wanted this to be really holistic, applicable across the field. And again, really, that was quite important to us. And that helps it be applicable to everyone in science. Again, we tried to not make it overly technical. We didn't think that was really helpful for anyone. And we'd love to see more students, early career scientists, take this at the start. Course content is very comprehensive. So what we did with this was we actually had an overview section where we went through brief history, original versus modern definitions, how it's relevant to culture of care, key resources, etc. Then we go into replacement. We go into what that F actually is defined as. We go into 4 key types of replacements, advantages and challenges of replacements, as well as future directions and case studies. Then we have reduction. We really overview what reduction can be, from experimental design, thinking about variation, data analysis, animal colony management, etc. We also have a very extensive refinement section. We talk about models of animal welfare, how to really assess animal welfare, individual roles in refinement. And then we go through a lot of key refinement strategies, whether that's housing, husbandry, handling, experimental procedures. We also go through harm versus benefit analysis, classification systems, and endpoints. And then finally, we have this section that we call kind of applications and more. It has some scenario-based learnings to try to apply the 3 Rs to particular scenarios. And then we also touch on other topics that we just thought were really essential for anyone working in the field. So we talk briefly about openness in the field as well as compassion, fatigue, resiliency. Now, you can actually access the course with City Program. I believe this is still the pricing for our members. It is a little bit cheaper. It's about per, $675 to $750 per year per site. If your organization already subscribes to City, oh, I think these prices are actually switched. Yeah, I think it's cheaper if you already subscribe. These might be slightly different, but it's around this amount. You can go on their website, you can see that, you can reach out to them, and then you can also purchase it as an individual. Now, that was all about the 3R certificate course. I wanted to give you guys kind of a deeper dive into that project, how we developed it, etc. I guess the one thing that I didn't mention is there are quizzes at the end of each section to really test that you learned things throughout. So that's important. But I also want to go into other resources from the 3Rs Collaborative because we do a lot of things that are totally free, that are easily accessible. It's not going to be as comprehensive as if you go through the entire 3R certificate course, but these could be really helpful to you in your position, others at your facilities, etc. So I want to make sure you're aware of them. So first off, we have this new Culture of Care resource hub. We have an overview page that talks about the 4 pillars of culture of care, and then we have a dedicated resource page to each pillar that really talks to what this really looks like. We have a poster that you can download. Again, this I think is super important and comprehensive for individuals and their organizations. As part of this, it's really important to us to support your people. So if your institution doesn't do anything related to compassion fatigue resiliency yet, we really encourage you to do that. And we have so many resources to help you. We talk about how to kind of launch a program. Again, we have posters, we have webinars, we have a survey. We have a ton of information for this. Um, you can access these again all for free online. We have this resource hub. We also have some individual resources. And one of the things that we have is a link between retention and professional quality of life. That was a formal research project that we ran. You can also use our resources to switch to refined mouse handling. This is actually picking up mice with, say, tunnels or cupped hands or huts instead of by the tail. And we see that more and more institutions across the globe, both in the United Kingdom, the United States, and Canada, are making this switch. Most of them don't find it really takes much more time afterwards. And again, we have a ton of information here. We actually have a free e-learning course that we developed with NC3Rs. We have mentorship, lots of resources here. We also have resources related to microphysiological systems, artificial intelligence, and environmental health monitoring. So we do a lot on microphysiological systems, these organ-on-a-chip organoids. We have this whole hub where you can find different MPS companies. You can look at their tissues, their diseases, their species. And actually, we just recently launched a publication hub where you can go online, filter, and find the companies right for you. Um, Again, we have tons of resources on this. You can access these. We have presentations, we have webinars, we have publications. We have a lot going on here. We also have an initiative related to artificial intelligence. Its primary objectives are to foster collaboration, identify and address barriers, encourage development and appropriate use of AI. We've got an overview paper going on. We've got a couple other things that we're working on. And again, this is a very diverse group with end users, tech providers, and regulatory agents. Another really important thing we do is related to replacing soil bedding sentinel rodents with environmental health monitoring. We've done a ton of work in this area and have a huge resource hub. Again, this is something where in the United States, I'd say 75% of organizations have probably switched. This is really the way things are going. We have a mentorship program. We have a systematic review showing it's 20% more effective. So tons of resource on this. If you still use sentinel rodents in your program, we encourage you to switch. We also have a whole initiative related to digital biomarkers. This is about kind of 24/7 continuous monitoring of animals, often in their home cage, video, RFID, audio, etc. We have 2 different papers. One is kind of this overview paper about using these technologies, and the second has a validation framework. And similar to our MPS initiative, we also have a technology hub that connects end users with relevant commercial tech providers. You can filter by these different aspects and find a tech provider that's working for you. Overall, my message is that, 3Rs change can be challenging. There's a lot to do, but we're really here to help. Our 3R certificate course is really a great baseline for training people how to implement, making sure that they have this baseline knowledge because you really need those individuals to change. And from there, we also have tons of other resources. And with that, I'll just end with kind of a call to action and thank the organizers for having me speak today. If you want to join us, we'd love for you to join our newsletter to stay up to date. We really focus on advancing better science for both people and animals. And you're always welcome to reach out to me via email with any specific questions. Awesome. Thank you.